Hello, I am Dr. Sreejoy Gangadhar, practicing homeopathy for more than 20 years in Kerala, India. Through this video, I want to discuss with you about the homeopathic treatments which can cure the thyroid problems. What is thyroid, its functions, its position, etc. I am not discussing with you because it's already available in Google or you may know about that. Usually, people with the thyroid problems are taking medicines or hormonal tablets for prolonged time or sometimes lifelong. These hormonal tablets or medicines are correcting the irregularities of hormones in blood, so that for after few weeks or months, if you check, these blood hormonal levels may become normal. But these hormones are not only reaches in blood but in cells or tissues also. This excess amount of hormones in tissues or cells causes symptoms like muscle cramps, muscle pain, muscle wasting, then chest complaints like chest pain, heart palpitations, sleep disturbances, skin conditions like erythema, rashes, the skin swellings, pedal edema, sleep disturbances, emotional disturbances, mood changes, etc. Because these hormones helps in oxidation and breakdown of proteins in tissues or cells. In goiter-like conditions, external iodine is supplemented. If excess of external iodine supplement occurs, then level of calcium in blood also increases. At that time, another hormone called calcitonin is released, which mobilizes this excess blood calcium to bonds. So this excess deposition of calcium in bonds causes bone conditions like bone tumors, exostosis or growing of bone ends, bone pain, etc. There are homeopathic medicines which can reduce the thyroid hormone level to normal speedily or easily, but you have to take it for prolonged time or sometimes lifelong. And those people who are taking these medicines also suffer from the same difficulties which I had discussed with you earlier. There are glandular homeopathic medicines which directly acts on the thyroid gland and normalizes its functions and shapes. For the first 2-3 months while you are using these medicines, the blood hormonal levels may remain unchanged or somewhat reduced. But the difficulties that are facing by the patients become normal or reduced. So after 2 to 3 months after taking these medicines, if you check, definitely the blood hormone levels become normal or corrected to be normal. The same result you may get if you have conditions like increased TSH levels, which is also synthesized in the anterior pituitary gland. Instead of using medicines, if you choose surgery, then there may be risks. If surgeon by mistake cut the nerves called the recurrent laryngeal nerve which passes through the lateral borders of the thyroid, then you may not get your sound further. So limit surgery as last option. While using homeopathic medicines, you may take this external supplementation or hormonal tablets in conditions like congenital and juvenile hypothyroidism until the thyroid functions become normal. Congenital means from birth and juvenile means in childhood. So what I am going to say is that while using these homeopathic medicines, you need not take any supplements or hormonal tablets except in conditions like this congenital or juvenile hypothyroidism, pregnancy, lactation, or in any acute crisis. In cretinism or hypothyroid patients, along with iodine deficiency, there may be deficiency of selenium-like trace elements, which reduces the intelligent quotient and the normal mental functions of the patients. But while using these homeopathic medicines, you may not suffer from these problems because our medicines helps in absorbing these trace elements from the food taking. So I am concluding by saying that by using homeopathic medicines, we can cure the thyroid problems and you can stop the medicines after 6 to 12 months, and you can lead a medicine free and difficult free life. Thank you.